According to a major study published in the New England Journal of Medicine, cockroaches have been identified as a leading cause of severe asthma in inner-city children. The study is known as the National Cooperative Inner-City Asthma Study. It involved 100 researchers at 8 universities in 7 major cities throughout the United States, including Cleveland. Asthma cases in the United States are not only on the increase, but also have become more deadly. According to the Cleveland's Environmental Health Watch, the disease has more than doubled in the past 20 years, and deaths of children from asthma has increased by 50% in the 1980s. Inner city, poor children are at the greatest risk. It is estimated that 23,000 Cleveland children suffer from asthma. To explain this phenomenon and to teach parents and homeowners what they can do to keep their homes cockroach-free, we'll be talking to Dr. Eileen Gilbert, who is an expert on asthma and childhood diseases. We'll also be talking with 2 exterminators, John Gideon of the General Pest Control Company and John Carter of the Carter Exterminating Company. These individuals will help explain the nature of the problem and what needs to be done to solve the problem. The codified ordinances of Cleveland prohibit roach infestation, not only in the health section but in the housing section. Roaches are unsightly, but also the infestation of roaches can be deadly for some Cleveland residents. I'm pleased to be here today with Dr. Eileen Gilbert, who is a national expert on asthma here at our Cleveland's Health Metro Center. Dr. Gilbert is a professor at Case Western Reserve Medical School, as well as being the director of the health clinic. And what is the exact title of it?
The Metro Health Asthma Clinical Management and Research Center.
So it's clinical management of conditions having to do with asthma, which is a problem, as we've seen in Cleveland. How great a problem is it, Dr. Gilbert?
Asthma in Cleveland, in the nation, and the world is a growing problem. We estimate that there are 15 million asthmatics in the country, that it affects about 5 to 10% of the population, but we do know that in urban cities such as Cleveland that have high minority populations, the prevalence, the morbidity, and the mortality is increased over general national averages. So maybe 1 in 10 people in this city have asthma.
So 1 in 10 people have asthma, and the condition seems to be focusing in greater numbers on the minority communities?
Absolutely, and we're really not sure if these statistics that we're seeing are a problem of access to care, availability of good care, patient and physician education, or there's something intrinsic within our inner cities where many of our minority populations live that are causing exaggerated problems with this illness, such as problems within the housing stock.
Well, Dr. Gilbert, I understand that there was a national study that a number of cities were considered, and the universities, I think 100 universities participated in the studies, including some here in Cleveland. And environmental conditions were outlined as somewhat being contributory to problems with asthma, not only for children but for adults.
Absolutely. The National Cooperative Inner-City Asthma Study, which was sponsored by the National Institutes of Health, chose Rainbow Babies and Children's Hospital as one of the sites in which they tried to identify risk factors for children with high asthma morbidity. And they were focusing on the environmental component and which specific allergens may be triggering severe asthma. And what they found was that for those children who were sensitized to cockroach allergen and there was cockroach allergen present within their homes, they had much greater morbidity from this illness. In our own programs where we are looking at the Cleveland community in both children and adults, we have found that those individuals who have cockroach exposure within their homes require very high levels of medical therapy in order to control their illness. So now both the children and in the adult population, at least cockroach allergen has been associated with severe morbidity.
As judge of the housing court, I see cases coming in on a regular basis having to do with infestation of people's homes. And not only the health code, but the housing code prohibit infestation. And then the next step, of course, is what does the homeowner do, whether it's a landlord or the tenant. Now, the infestation of cockroaches appears to be a problem and a contributing factor. How does it manifest itself as far as the health condition of asthma?
Asthma is a chronic illness. Even at times when the patient appears to be in a quiescent phase, there is underlying airway inflammation. When someone is exposed to an allergen such as cockroach or mold or cat dander or dust mite and they're sensitive to it, they develop airway narrowing, swelling of the airways, and that manifests itself as coughing, wheezing, shortness of breath, inability to sleep at night, inability to perform activities of daily living. And not only does it affect children's ability to go to school, parents' ability to work, but it is a life-threatening condition.
The cockroaches themselves are nuisances, but according to some of the experts that we've talked to, what they leave behind, fecal matter, carcasses, add to this airborne problem.
Right. What happens is the human body responds to this matter as a foreign substance, and it develops antibodies against the substance. These antibodies, once they're developed, remain a potential within the body forever. So even if the person has a quiescent period and they're not exposed to cockroach, if they again get exposed to the allergens associated with cockroaches, their immune system is revved up. They have immunoglobulins placed upon their cells within their lungs. Once the allergen is inhaled and bridges these immunoglobulins, chemicals get released from activated cells within the lungs. They cause the smooth muscle of the lungs to constrict. They cause the airways to swell. They cause damage to the lining cells of the lung. They cause the patient to produce mucus, all of which markedly compromises their respiratory status.
Now you talk about morbidity. Now I knew that cockroaches were a nuisance, but it can lead to a condition that can be fatal.
Absolutely. The death rate from asthma has been rising since 1979, despite the fact that there have been published guidelines nationally and internationally for proper diagnosis and management since 1991. And we have a large campaign to help patients and physicians treat this illness with education and with pharmacotherapy. But despite this, people continue to die at very high rates. There's about 5,000 deaths per year in a population that shouldn't be dying. These are usually young people who have no associated comorbid conditions. So it is very worrisome to see continued elevated death rates despite greater heightened awareness about how to diagnose and manage this illness.
So it can be fatal to children who are healthy and young and vibrant, and then for the elderly population who already have some other health conditions, it can be a major contributing factor.
Right. Airway obstruction can exacerbate underlying cardiac disease. Sometimes it's difficult to separate out components of respiratory distress between cardiac and pulmonary. And indeed, when we look at who has increasing rates of morbidity and mortality from asthma, it's not only children, but it is in patients over 65.
The infestation of cockroaches is one problem and a substantial inside environmental problem. What are some of the other problems that people would have inside their home as opposed to on the exterior of their home?
Okay. Another condition that leads to the exacerbation of asthma is conditions in which there is high humidity. When there is high humidity, the allergens get soaked into the carpeting. They are much more difficult to remove. It allows molds to grow, and molds are also very highly sensitizing agents. They may be another allergen that is contributing to our increased morbidity and mortality from asthma. Pets, of course, many people are sensitive to pets, and again, their dander gets into carpeting. It gets into carpeting more when there is humidity, within the house. The patient tries to vacuum their carpeting and just aerosolizes the allergen, and they get a greater level of exposure. Dust mites are also ubiquitous in everyone's home. And again, under hot, humid conditions, they tend to settle into carpeting, they settle into stuffed animals that children have, into upholstered furniture, and all of these are continual sinks for sensitization of adults and children, as well as triggers for acute exacerbations of asthma.
So by vacuuming, that helps exacerbate the problem?
If
Is
you
that
do
right?
not have a special vacuum with a special filter, you actually may be putting yourself at greater risk. Some of the cleaning solutions that people may use to decrease the mold, if they are strong smells such as ammonia or bleach, that actually is another trigger, the very strong smells and odors for asthma exacerbations.
Mm. Now, as far as smoking in the home, is that a contributing factor
Yes,
as well?
everyone believes that smoking exacerbates asthma. It causes increased respiratory difficulty in children when they live in homes of smokers. That's another indoor trigger of asthma that we're trying very hard to ameliorate within the population. But of course, we all know that it's also an addictive habit, and we need to help patients get the resources they need to stop. I don't think there's too many asthmatics who don't want to stop, but there is an addictive component to smoking.
Dr. Gilbert, at this time, is there anything that you would like to say, keeping in mind that our show is going to be aired in the city of Cleveland, which is 500,000 people, 224,000 housing units, and some message that you'd like to get across?
I think it is very important for the people of Cleveland to realize that this is a significant factor in our community. We have increasing morbidity from asthma, and we are not sure what is causing this, either locally or nationally. We now have good studies showing that we can make people feel better with medications. We can teach them how to manage their illness, but we still have a significant amount of residual morbidity. And looking at our homes, looking at the allergens in our homes, how to better construct our homes, how to decrease humidity, may be our answer to solving some of our questions as well as our morbidity with respect to asthma.
I'm here with two Cleveland experts of companies that have worked in the city of Cleveland as well as outside the city of Cleveland. John Carter from Carter Exterminating Company, thank you for coming and visiting with us today. And John Gideon from the General Pest Control Company. How long has Carter Exterminating been in existence?
Well, we started in 1937, quite a while ago. My grandfather was a World War II veteran and picked up the skills there, and we incorporated them into our family business. So we're a 50-year-plus company.
And how about General Pest Control?
Like 1937 is a magic year. That's the year my father likewise started in business.
So both of your companies started in 1937, and both of your names are John. So there must be some linkages here.
We have some.
We're here today in the kitchen of the home that we're just on the outside of to talk a little bit about the steps that people need to take to abate the nuisance of pest control. But before we get into that, we need to talk about the pest and the type of pest that they've encountered in this home, the type of cockroach. And I understand that there are several different types of cockroaches. And in fact, they cover a wide ethnic names. And I understand that there are German cockroaches and American cockroaches and Oriental cockroaches, as well as brown-banded cockroaches. What are the problem roaches in this house?
Well, we found large infestations of German cockroaches. German cockroaches are typically the #1 cockroach pest you're going to find in people's homes, primarily because they populate so fast. The main differences between the 4 types of roaches that you talked about, besides their names, is that the temperature variances in people's homes usually dictate which type of roach problem you may have. Normally, German cockroaches will have a predilection for the same temperature environments that we're comfortable with, and consequently, that's why we have more problem with them. American roaches, for example, like a lot hotter environments, such as steam tunnels or basements of industrial buildings, so you'll find a larger concentration of those in those areas. So it's a temperature difference that really dictates where you'll find a lot of the 4 roaches that you spoke about.
I see. So in homes in Cleveland, generally it would be the German cockroach And there's also the brown banded cockroach.
Brown banded cockroaches like temperatures that are a little bit different than Germans. You'll find them a little higher up in the home usually. Typically, Cleveland homes or buildings, their heat is generated in the foundation or the basement. The furnace room or steam tunnel is usually warmer. You'll have Americans at that level. German cockroaches like it in the area that we are now, between 65 and 75 degrees. Brown banded's like a little bit higher than that, and they'll be up
And
a
it's
little
found
higher.
that the German roach is the cockroach that causes the asthma problem from what it leaves behind. Is that right?
The German roach is the one that's been subject to the studies because the roaches are found living right with people. I would be pretty certain that if they studied also American roaches and Oriental roaches, the same allergens would be associated with them.
I see. So we're in the kitchen of the home, which is one place where roaches have been seen in this particular home. And what type of environment is the environment that the roaches seek?
Well, you must understand that roaches are parasites of man. We don't like to think of it that way, but actually they are. Horses have parasites, other animals do. Roaches are one of the parasites that can live, as Mr. Gidding has stated, in an environment in which we're comfortable. Consequently, they can live in any environment where man is. It's not a question of whether it's too clean or not clean enough. Those factors play an important role. But German roaches have adapted completely to environments in which we're comfortable. So therefore, wherever man is, wherever his food supply is stored, wherever his harborage is, roaches can usually make it as well. We have to take steps to make sure that that doesn't happen. And we've done so in this home. We've treated it with a process of vacuuming, first to eliminate live roaches, and then baiting with an attractant which makes roaches come to it rather than traditional pest control where we took the chemicals to the roaches more than is the case today.
Now there is a change in philosophy as far as the abatement of roaches, an integrated pest control strategy. And so many times in the past, people used whatever means possible to eliminate roaches. Foggers, bombs, boric acid. I've seen people apply heat. I've seen people apply cold. What is the strategy today?
Well, certainly the older methods of, I think slang was called, spray it down and fog it up concepts just didn't produce consistently good results. A number of years ago when the roach baits were developed, when they finally got a good attractant to feed cockroaches, it changed the technology in the business, and now we're able to go in and place small amounts of material in cracks and crevices and we get the roaches to come out and eat it, and that kills them.
Now, roaches are in an environment that has food, water, and shelter. Could you tell us a little bit about those three elements?
Just as every living thing craves those things to survive, roaches do as well. And as I stated before, we are particularly suited to provide them the things that they need. The temperature is correct, the food is correct, the homes that we live in provide a lot of shelter. There's cracks all over the place, there's hollow void areas. There's areas in our homes that we've never seen, but roaches frequent all the time. One of the methods that my company employs is to concentrate on putting the insecticide, or in this case the bait, where the roaches live, not where we live. Mm-hmm. By that I mean placing it in cracks and crevices where the only thing that will come in contact with it will be the roach, not us.
I see. Food, shelter, and water. What are your thoughts on that?
Well, the researchers have pretty well concluded that the most important thing that a cockroach needs is shelter. It needs a place to hide. I mean, it's a very small creature. How much water and moisture does it really need? And a little smear of food left on a counter is plenty of food for it. The limiting factor is really where it hides. Roaches spend about 75% of their time hiding. In a day's time, that's 18 out of 24 hours, they're in a crack or a crevice. They come out at night to feed and go back and hide in the cracks and crevices during the day. So if you're starting a program of treating for roaches, you have to take the battle right to where the roaches are, into the cracks and crevices.
And what do you do with the cracks and crevices?
Well, if you want to eliminate the roaches, the first step, and as John has demonstrated in this particular case, is go in and vacuum them out. Just suck them right up.
So you use a household vacuum, is that right?
Okay. They're telling us that we should use vacuums that are equipped with HEPA filters, because you want to make sure that As you're sucking the roaches in, you're not discharging any roach particles, dust out through the exhaust. So you need a pretty good filter bag to make sure that that doesn't occur.
Now, you talked about roaches coming out at night. Now, what if you see roaches during the day? Does that mean there's a heavier infestation in the house?
Generally, if you do see roaches during the day in ordinary daylight hours, it means that the cracks and crevices or the hiding places are filled up and it's crowded. And so in order to survive, they're out looking for new cracks and crevices.
So there's a theory about carrying capacity of a structure. It can support so many roaches, and once that gets to be too much, then they're out of the cracks and crevices during the day. They're a sort of a nocturnal insect, is that right?
Right, they're a nocturnal insect. The carrying capacity concept is based upon how many accessible harborages are there for the cockroaches. And the more cracks and crevices there are, the greater the carrying capacity, the more roaches there possibly could be. So one important step is to eliminate the cracks and crevices.
And how do you do that?
You can do it by caulking, by sealing, going around with some spackling material and making sure cracks in the walls are filled up, caulking compound around doors and door frames, ordinary repairs, making sure tiles and the grout are well sealed. Good construction practices are also an important part of that.
Okay, John?
Well, for example, in this home, we found that not only were roaches in the kitchen, but there were also in the living room and dining room areas. And you may wonder why there's not a lot of food there, but as John has suggested, once the cracks and crevices in this room became full, the only available crack for the newly hatched roach would be on the other side of the wall because these are already full, so they move back further and further. It doesn't mean that a separate infestation is normally living, but it means that in order to get to the food in his kitchen, he had to travel around those areas to come here because all the available cracks were already filled with roaches.
Now, there's been some discussion with defendants that have been in court where they've sprayed their homes, but primarily sprayed the kitchen. And I guess this is an old theory that if you spray the kitchen area, you should help abate the roaches. But what it did is drive the roaches into other areas of the home where they didn't have the food or shelter available to them, but it just propelled them out of the kitchen. What are your thoughts on that?
Well, my thought has always been that the roaches were probably there already. That merely spraying in the kitchen didn't magically drive the roaches out. They were already spread through the house. Mm-hmm. If you think about it, our habits today, we just don't eat in the kitchen. There's a lot of eating and food carried in the dining rooms, food carried in the bedrooms, where people watch TV. And so we've done a good job of moving the roaches around ourselves. Certainly, if somebody applies insecticides, sprays, or bombs improperly, there's a chance to spread the roaches. But remember, that creature has 6 legs, and they know how to use them, and they'll travel around.
Now, they not only like food, but any sort of protein-type product, fingernail clippings, and is what I've heard. Is that correct or not?
Well, roaches can survive on a wide variety of food sources, some which we would not consider food. But when pressed, roaches will even cannibalize themselves. So what they'll survive on is wide and varied. And it's difficult to base a whole program based upon eliminating those things. It's difficult to do. To touch on your other question as far as spraying techniques, what you'll find is a lot of our clients that come in initially think that spraying baseboards is the key to doing it, since historically that has been where pesticides have routinely been placed. But I find very few roaches that'll crawl from a cabinet down to the baseboard to commit suicide. So if you think of it in that terms, we have to take the chemicals where the cracks are, and sometimes the layperson doesn't have that knowledge clearly in place. We try to tell our customers that your home is, if you will, sort of like the human body. The skin of your home is like your skin. It's designed to keep things out. If you have roaches in your home, it's sort of like a disease in your body. You want to make sure that you don't use a hammer in order to, to pull a fingernail off or something like that.
We're here with a family that has taken steps to improve their environment and their home. And they've moved into this property and found out that it was severely infested with roaches. This is a great home, well cared for, and under renovation. And it's going to be a wonderful place for a family to live. I want to ask, what were the conditions when you first got into the home, and how did you find out about this infestation?
Well, when we moved in, the apartment was in a very good shape. It had a lot of wallpapers, and since we don't really like wallpapers because we know roaches could hide behind them, so we started cleaning them out. That's when we noticed the infestation because there was a lot of them right behind them.
Uh-huh.
We had to knock down some walls because they were kind of old. That room we had to knock down almost all the walls down and put them back new. And the rest of the house, at first all we really did was paint and fix what needed to be fixed. And then after a while, we started remodeling the apartment to the way it is now.
To the way it is, and you've done a wonderful job. When you moved in, you found that the infestation was so bad that you couldn't even put food out. Like I know there just was a birthday here, and you had a birthday cake out, and you couldn't do that before.
No.
Is that right? What did you do then?
Then we tried every egg killer, combat, spray, bombs, everything we could find, but nothing would have helped.
And there's a certain point when the infestation is just too great that you have to call in the professionals. And you were at that point, and you moved in a house that was infested, and so you've cooperated with the professionals on making sure that everything is done the way it needs to be done. And looking around the house, I see that you've filled in a number of the cracks that were in here.
Mm-hmm.
You keep the outside clean, the garbage cans are away from the house, and on the inside, you're taking steps, and there are probably a few more steps that you're going to take as your renovations continue. I can see that already the home improvement is going on here at an early age with the hammer and the 2x4. You look like you're very busy. Thank you very much.